Um, I think folks at home can be assured that the leaders behind and next to me here have not only been leading in on this pandemic, they've been acting and issuing orders and education that is based in science and with the backing of the public health system, really based on the best information and recommendations that are out there. It gives me a lot of confidence that the leaders up here have been doing what leaders should be doing. This is still a very new virus, and there are a lot of things that we don't know about it. For example, we don't know what the mortality rate will be. We don't know what the hospitalization rate will be. We can make guesses. We don't know the degree of asymptomatic infection that's out there, and we still don't know some of the mechanics of how this virus is spread from person to person. You can call those known unknowns. What we do know is that the single best way to decrease the spread of this virus is for people to stay at home. The more people stay at home, the less this virus will spread. It's that simple. And I'll repeat it. Stay at home, stop the spread. We believe that the next week will be a crucial week in our outbreak. We're able to affect the trajectory really with this week, and what we're trying to do is avoid a flood of our hospitals. We're trying to preserve life-saving acute care, ICU care for the patients that will need it, and in order to do that, we have to limit the spread of transmission, particularly in this next week and the few weeks to follow. That's why staying at home is going to be so very important. We just concluded a weekend of drive-by testing sites across the two parishes here. Those went very well. There was a collaboration between local, state, and federal officials. A lot of work went into it, and it was a great result. There's still a lot of people that have symptoms, maybe mild symptoms, and they have not been tested. In outbreaks like this, it will be impossible to diagnose 100% of the cases out there. There will be people that have COVID that will not get a certain diagnosis. I'm going to tell you what those people should do. If you have symptoms and you're concerned that you might have COVID and a test is not immediately available for you, please stay at home until 3 days after your symptoms resolve. That is the recommendation that we would give even if you had a confirmed case, is to stay at home until 3 days after your symptoms resolve. The governor has ordered us to immediately begin expanding the capacity of the healthcare system across the state, and particularly here in the greater New Orleans region. That's going to be inside the walls of hospitals with more beds, more patients being cared for, and also in non-traditional healthcare settings. This will likely be the greatest single expansion of healthcare capacity the state has ever seen, and it's going to happen over the course of 10 days. The goal here is to increase the capacity of acute life-saving care. Once again, the single greatest thing you can do to help mitigate this pandemic is to stay at home, like every person beside me here has asked you to. I will add one other thing, and I'm glad that Madam Mayor mentioned this as well. Brothers and sisters you might have who work in the healthcare industry, who work in hospitals, who work in clinics, they're working awfully hard right now. They're working very long hours, and they're oftentimes being asked to do that without maybe all the protective equipment that they need. They're putting themselves on the front lines for everyone else. So I'd ask you, if you know anyone that works in the healthcare industry, it's a good time now to reach out to them, give them a call, give them a text. Just let them know that you're thinking of them and you thank them for what they're doing. Thanks.